Hello everyone for who joined today's webinar. Let's give people 1 or 2 minutes to join. Do we get started, Joe?
Go ahead.
Is there? Okay. Hello everyone and welcome to today's webinar, The Next Gen Physician, or Tomorrow's Doctor Ready for Today's Technology. So my name is Claire Hao and I'm pleased to be your moderator for the next hour. And we are so delighted to welcome so many to join today's discussion on the future of medical education and digital health. And before we start, I'd like to acknowledge that the lands on which we gather for these events are the traditional territories of many indigenous nations. Canada Housing Fully recognize that the profound and ongoing injustice experienced by indigenous people in what we now call Canada, which continue to impact their health, well-being, and we honor the resilience and strengths of indigenous communities and their rich cultural heritage, which contribute to our understanding of improved health outcomes. I invite all audience to reflect on the territories from which they join us. Let's commit ourselves to deepening our understanding, fostering genuine relationships, and actively contributing to reconciliation efforts. And together, may we strive to create a future of respect, understanding, and partnership with Indigenous peoples. And also a quick word about Infoway. We are a pan-Canadian not-for-profit organization funded by Health Canada. So Infoway works with all 13 provinces and territories to strengthen health systems through digital health innovation. Our priority include standardizing digital tools and services across the country, driving interoperability solutions, and also advancing connected care by addressing health IT gaps, setting data standards, and collaborating with industrial partners. And here is today's agenda. So we are diving into the results of 2025 Canadian Medical Student Digital Health Survey and hearing directly from those shaping the future of clinical practice. So we will start with Sunang Kinapian, a final year medical students, who will present the key finding from this survey, and then Dr. Rashaba, a senior leader at Infoway, will provide an overview of digital health technology adoption in clinical practice. And next, we will hear from Noel Sandertel, a medical student and also a connective care clinical student scholarship winner on advancing knowledge and digital fluency among students. And also a few quick housekeeping notes. So we will wrap up with a Q&A session. So please submit your questions at any time by using the Q&A function at the bottom of your Zoom screen. And also, this session is being recorded, and both the recording and today's slides will be uploaded afterward to Canada Housing Forward's Insights website. Um, Like I said, our first speaker is Sunang Kinapian, a final year medical student at the University of Calgary. Sunang has a strong interest in family medicine. He served on the Digital Health Interoperability Task Force, and he's leading national research on electronic health records interoperability and digital health education in medical schools. Suna has a unique professional journey. Prior to the medical school, he worked as a management consultant at McKinsey and Company, advising healthcare and life sciences organizations across Canada and the US. He has also worked with Cleveland Clinic Canada on employer health strategy and care delivery innovation. So Sunang is passionate about building scalable patient-centered care models that bridge clinical practice, policy, and technology. And also, I want to mention the idea for the 2025 Canadian Medical Student Digital Health Surveys actually originated as an initiative within the Digital Health Interoperability Task Force. So where Suna and served alongside with Dr. Bai, who is the second speaker today, and other clinical leaders. So this national survey is a continuation of that initial vision. As a core lead of this survey project, I believe Suna is the best person to take us through these significant findings. So Suna,
Thank you,
over to
Claire. That
you.
was a very kind introduction. As Claire mentioned, this initiative was part of a larger initiative with the Digital Health Interoperability Task Force, led by Dr. Bayat and Owen Adams at the Canadian Medical Association. And at this point in time, the medical student survey, it's been a couple of months since, probably around 2 months since we released these survey results. You can access that online on the Infoway website. And definitely has been an initiative that was a Canadian Federation of Medical Students, the FMEQ from Quebec, the AFMC, and many people behind the scenes that made this happen, including Claire, who led many of the important parts of the survey. Now, Claire, if you can push us to the next page, I can give an overview of this survey. Perfect. We can just jump
Next.
to the next page.
Mhm.
Fantastic. Okay. So the survey was intended to reach as many medical students across Canada and understand the current state of medical education when it came to digital health. Our aim was to hit 5% response rate, working with medical schools and student associations within those medical schools. The aim was, of course, 5%. We were fortunate to be able to break past that with great collaboration from medical schools and student associations, as well as our work with CFMS and the FMEQ. We ran the survey in October of 2025. It was an online survey, 5 minutes or so. We ended up reaching about 1,100 medical students and reached 17 of the current 18 medical schools. The only school that was excluded at the time was the Toronto Metropolitan University, which, as we all know, is a new school in Canada. But we did, aim to reach all of the operating schools across Canada and had fairly good response rates across most, and ultimately hit 8% of the enrolled medical student population. I'll go to the next page and give you an overview of the key topics that were covered throughout. Now, the first topic that was important to us was understanding what is the current state of exposure and learning in digital health, right? So this is what does curriculum currently look like? What do students currently use, and what was their prior exposure prior to medical school? The second piece was more around competency, asking, regardless of education, regardless of exposure, are medical students actually able to execute on some of the key clinical and non-clinical tasks that will be expected of them in the future? And and the third piece is more about attitudes and expectations. There are divergence. There's a certain amount of divergence that you can appreciate within the student population on what is the possibilities related to new technologies like AI and digital health more broadly, whether it be positive or negative. And the final piece was around where do we go next? Like, what are the key barriers that are making digital health education in Canada difficult? And identifying those barriers so that we can execute on them moving forward. So I'll now walk you through some of the most important and interesting findings from the study. But of course, as I mentioned before, all of the deep dives and all pieces of our data findings can be found online on the InfoWay website. Now, when it came to prior exposure, as you can see, the majority of medical students seem to have some form of digital health education prior to medical school, but there's still a sizable portion that would not self-identify as having any exposure to digital health, about half of those students. Now, when it came to the training that medical students are receiving at school, it's somewhat similar, about more than slightly over half of medical students in the country, 57%, claim that there is no training at their school, right? And even in those that there are, um, there's mostly optional sessions. And there are some teaching as part of the curriculum, but unfortunately, it's not an important part of assessment, and it is not considered part of a requirement to graduate. And so it's not really a foundational part of the majority of medical schools in Canada. And we'll hear from Noelle later in this talk a bit more about her experiences as well as a current medical student. I'm currently graduating medical school. And of course, there's lots of differences across the nation. But in general, right, the current state, especially from the survey data, seems to support that there's still some movement to be made when it comes to pushing digital health into our curriculums across the country. I'll go on to the next page here and talk a bit about, regardless of education and exposure, what sorts of tools medical students are using. And there's two parts to this. The first part is around what tools are medical students using for learning and what tools they're using for clinical training. And so here we're focusing on that clinical training component. The top three resources that students are using right now, as you can see, are UpToDate, MD Calc, these types of clinical reference platforms. Secondly, we might assume that ChatGPT, Gemini, and Claude are at the top of a student's list when it comes to medical reference during clinical training, and that doesn't seem to be the case quite yet. Number two, we still see online search that's traditional, and the third piece is accessing and using electronic health records. And then after that, we see these new AI chatbots, the decision support tools that are being integrated into clinical workflows for students. Now, I think the key insights for me here are that Google and search end results continue to be dominant. We definitely do see the emergence of ChatGPT, open evidence into the clinical training sphere, and medical students are using these resources increasingly. And I suspect that this trend will only increase as time goes on. There's definitely something to be said about how medical schools should support or incentivize or maybe disincentivize the use of these resources, as they can be non-deterministic. Now, the other key insight that I'll share is around the exposure to these EHR tools, right? So, of course, EHR tools are an important part of clinical training, and most students use them regularly. But as we'll see later, there is a hook there around whether these tools are being used effectively, or even students are getting exposure to these tools prior to clinical training, meaning in the first half of their medical education. We can go on to the next page now, Claire. And this is really asking the question, how comfortable are students when it comes to navigating the digital health environment? Now, of course, this is a general question. It's hard to know exactly what this would mean to an individual student, but largely, students feel somewhat comfortable. An average score of 3.2 out of a scale of 5 in terms of their comfort when navigating digital health. Um, And there's definitely students on either end of the spectrum. And if you deep dived into the demographics of the student population, especially in Canada, incredibly diverse from an age, undergraduate education, prior exposure, employment standpoint. And so there definitely is a wide range of medical students, even with respect to technology, coming into incoming classes. And that does mean that there will be somewhat of a spread. We'll go to the next page here, Claire. And we'll actually ask the question here of where are medical students the most confident, right? And this is with respect to specific clinical tasks that are going to be important components of future practice. Now, when it comes to where students feel the most comfortable, they are in the areas that you would most expect. Things like electronic health record usage, retrieving health data across multiple platforms, messaging, communicating between providers, running virtual visits. These are all generally very, very good. And as you can see, there's a spread between the students that are the most confident with them, those that are somewhat confident, and there's still a large population that seems to be not confident with many of these tools, even in the foundational tools like electronic health records or medical decision support tools, or clinical decision support tools, I should rather say. Now, one of the things that also want to just bring focus to are the least or the top five least confident clinical tasks. And the important ones to note are actually these advanced interoperability tools, is what I like to call them. Things like e-consult and e-referral, right? These are the tools that are most likely to support interoperability and breaking down administrative burden. And these are new tools. E-consult and e-referral are not standard clinical practice in all systems, and many of these tools are still developing at this point in time. There's also some other interesting new technologies like wearables, population health tools that are largely not comfortable. The majority of medical students have never used them, including myself. And these will likely play an important part of what it will look like to be a physician in the next 20 to 30 years. And the other key one I want to mention is around messaging patients. There's actually a fair disparity between how comfortable students feel messaging between providers and then messaging patients directly. At this point in time, there is not much of a clear connection that medical students are aware of between themselves and patients on the digital sphere. And this is something that's still emerging. Making sure that students are comfortable engaging patients offline asynchronously, as this will be an important part of future clinical practice. We'll go on to the next page here, Claire. Awesome. So this page is really focusing on the clinical topics that are being covered when it comes to digital health. Um, Now, the important part of this page is actually just comparing what do students find interesting to learn about and what do they think their priorities are, which you see on the right side of the page. And on the left side of the page is what students are actually learning. I mean, what are the key topics that are being taught in medical schools? Now, I'll focus on this, very similarly, just try to identify the disparities between these two sides. Of course, the basic clinical exchange systems are very important. Things like EMR, health information systems, health data exchanges. These are critical tools in infrastructure, and they're definitely being taught, and students find them very important. Now, the concerns are more so on the disparities where there are modern, AI tools that seem to be a top priority for students. Things like AI scribes, clinical decision support tools, and they are increasingly being taught in medical schools, but significantly less than these basic clinical systems, right? So as we emerge into the next, 5 to 10 years, AI scribes will become, standard of practice, and schools should likely make this a priority and where to and where not to use much of these tools. And when it comes to this topic of the final of the top three, these advanced clinical systems, things like patient portals, e-consults, e-referrals. I think the survey team were very surprised actually to see this as being the top tool. I consider many of these tools as actually being, the interoperability tools, things like e-consults, connecting different systems, e-referrals, and e-prescriptions. And to medical students, this was a top priority, but unfortunately not an important part of the current state of medical school training. The final thing that I'll mention is data privacy and cybersecurity. From my own experience, this is a critical topic in digital health training within medical school, and it is the number two topic that you see on the left side. And as you can imagine, most medical students are not immediately interested in that topic. And I think this is something to think about. Data privacy and cybersecurity are fundamental prerequisites to being conscientious and responsible stewards of medical data, especially in the modern age. But there's definitely a balance between um, uh, data privacy and cybersecurity and actually being able to feel comfortable using tools that there will be a balance between those two values. We'll move on to the next page here. Now, this I just bring a little bit of focus towards. Um, this is the first part of the journey, as I mentioned before. There's medical learning, which is learning content, and then there's clinical training, which is typically happening during the second half of medical school. And there is a somewhat of a differentiation between the types of tools and resources that students are using in both parts. The biggest difference that you see between both parts is the emergence of clinical reference tools like UpToDate and Dynamed during clinical training, but the relative absence in the medical learning component. And the relative importance of AI tools like ChatGPT and Open Evidence during medical learning, as you can see, that's number two here, but it drops down to number four and five during the clinical training section. And then finally, there's lots of these multimedia reference tools that students use across the country. YouTube, podcasts are an important part of what it looks like to be a modern medical student. From my own experience, and Noel will speak to this as well later, there's definitely a change in the types of resources that students view as being gospel when it comes to training and learning. Move on to the next page here. This page was really meant to signify what students currently feel, whether they love or hate technology. And as you can see, generally there's a level of optimism and a level of deep appreciation for the impact that digital health and technology will have on future clinical practice. And so I think that signifies that students are generally interested in digital health. They know it's going to be impactful and generally do feel that there is some amount of optimism. We'll move on to the next page here. And we'll talk a bit about where the key areas of clinical of benefit are seen for students. The first and most important is clinical efficiency. The belief that students will be able to use digital health technology to improve their clinical practice. But also, number two, about 80% students feel that this will improve access to care. Digital health tools will ensure that patients can get quicker access to their physicians and other members of the care team. And we'll move on to the next page here. This is more about the key concerns or the pessimism associated with digital health. And the key concerns are truly privacy and security. This is understandable. There's significant risks to patients as well as physicians, and when it comes to sharing information of health data. And a lot of this, I suspect, comes from the fact that the majority or a key focus of modern digital health education is privacy and security. It's very apparent to the majority of medical students that that is a key concern, and it's being talked about in medical schools in formal curriculum. The second piece is understandable, the over-reliance on technology and whether that takes away from intrinsic capacity. You also have concerns around patient connection, and also the concerns around introduction of bias. Now, the thing that may be most interesting to many is that 40% of students do feel that there's a risk of job replacement and job loss, and that likely plays into some of the pessimism that students feel. And Noel likely will be able to talk about this later around, uh, you know, the the opportunity that she feels around AI and digital health, but not all students feel that that will help them in the future and may hurt their career prospects. We'll end on the last page, which is really a call to action around the barriers when it comes to digital health in medical schools. Now, the most important barriers that students feel, the top three that just really do matter, these are the reasons why medical students don't feel comfortable with or don't feel that they are able to learn digital health as much as they wish. The first is the lack of formal education. As we know, validated at the beginning, only about half of medical schools have formal digital health education curriculum, and it is not an important part of assessment. The second piece is simply access to these tools, most importantly, things like EMRs during training. And then the final piece is time constraints. Medical students have much to juggle during their training, and they're prioritizing constantly. So if we feel that digital health is an important part of clinical practice, that's something that we should make more time for in the future. Thank you so much. I'll pass this on to Rashad.
Okay. Thank you, Sunil, for sharing those important early findings. And due to the schedule, we will save the question for the end. So if you have any question for Sunil or any question for that part of the presentation, please feel free to use the Q&A feature in the Zoom. And I will introduce our next speaker. So I'm honored to welcome Dr. Rashad Bayat, a senior clinical leader at Canada Health Infoway and an award-winning family physician with special expertise in digital health and medical informatics. And he also supports Toronto Metropolitan University's new School of Medicine as assistant clinical professor and recently led the integration of digital health into their medical curriculum, the first in Canada. So over the past decades plus, he has provided InfoWave with strategic leadership and advice on key national initiatives like AI in healthcare interoperability, etc. And he also as the co-chair of the Digital Health Interoperability Task Force. And currently, he practices in Digital Enabled Family Medicine Clinic in Brampton, Ontario. So Dr. Bai is going to talk about the digital health technology adoption in clinical practice. Dr. Bai, the floor is yours.
Thank you, Claire, for the kind introduction. And Sunan, thanks so much for presenting those insights into the survey results. And I should just note that it was Sunan's brainchild and pitch through the Digital Health Interoperability Task Force that got this whole survey going. And Claire has been a force, keeping everything moving. So, hello, everyone. My name is Rashad Bide. It's a pleasure to be here. I should just note that InfoWay's programs and activities often occur in the background and rely upon partners from across the country who do a lot of the heavy lifting. So I just wanted to say a huge thank you to all the partners who made this student survey on digital health and AI a possibility, including Claire, Sunand, Mohammed Abbas, Marjorie Coulomb, Owen Adams in the CMA, the CFMS, FMEQ, our amazing research and analytics team. I already mentioned Claire, but also Waldo Bossiger and Bobby Georgiou. So I'll be providing you with some reflections from a mid-career practicing physician perspective on the current state of the digital health landscape and how furthering the integrated instruction of digital health, including AI, into medical education can benefit all Canadians in the future. Next slide, please. So this is me on a typical day in the clinic in our current state of disconnected care, and I have a relatively small practice. It's much more challenging for family physicians who have large practices. If this is our current state, the question is, can trust be rebuilt in a meaningful digital transformation in Canada that truly engages physicians? And if there's one thing that you remember from this talk, it's that through clinical engagement, co-design, education and training, yes, it is possible, and that AI-powered tools may be a promising part of this equation. Next slide, please. So it probably won't be news to our audience, but physicians and other clinicians are now practicing in digital environments, reflecting a massive system transformation. over the last 20 years. However, digital health in Canada has evolved in a chaotic manner, with many challenges downloaded upon physicians and other clinicians, frequently without our input, with negative impacts upon mental health, patient safety, and equity. And Canada is facing multiple large challenges in healthcare exiting the pandemic. Clinician burnout, often linked to administrative burden, particularly in primary care. An interoperability gap. There's a lack of true health data interoperability with lots of siloed systems across the country. And patient safety risks. The risk of harm to patients is real due to the interoperability gap, and this has been highlighted in reports such as the Interoperability Saves Lives report and by our Digital Health Interoperability Task Force report. Next slide, please. So the data on the following slides helps to paint a picture a little bit further and comes from our 2024 physician survey results, a partnership between the Canadian Medical Association and Infoway's research analytics team. I should also mention that Commonwealth Fund survey data will be the most recent Commonwealth Fund survey data will be released soon, and Bobby Georgiou is involved in that work. This is a very good news slide on the surface. 95% of all physicians saying they use EMRs or EHRs to enter and retrieve clinical notes, an increase from 87% in 2021. However, if we flip to the next slide, you can see that this is the so-called pajama time finding. The average time spent on an EMR after a typical workday by physicians who use one was 107 minutes, and 51% said they spent 2 hours or more. So it's an unsustainable situation that's driving family physicians to retire and making it challenging to recruit new physicians to primary care at all. And again, linking this back to our medical student survey results, what can be done upstream? Next slide, please. So nearly half of physicians, 44%, report feeling burned out to some extent, with 5% feeling completely burned out. This is an ominous finding, again, in the context of mounting challenges with difficult to use digital tools and low levels of interoperability, making it even more challenging to encourage young people to enter community-based clinical practice. Next slide, please. And all of this context led us to a key thought leadership activity that Sunand and I have mentioned, the Digital Health Interoperability Task Force. So burnout, administrative burden linked to the current state of disconnected care had not been explored in depth through the physician lens at the national level. So a partnership was struck between Infoway and the three leading national physician organizations, the CMA, the CFPC, and the Royal College, that brought together 17 senior physician leaders from across the country with experience and understanding of the digital health landscape, along with nursing and patient representation. Sunand was part of this task force. I was fortunate to co-chair it with Dr. Samuel Ogunbi from the Royal College and now with Dr. Jonathan Wong from BC. In summary, the task force had three goals. First, to provide a physician perspective on the current state of interoperability or lack thereof in Canada. Second, to stimulate approaches and innovations to overcome key barriers to physicians. And third, to ensure that the implementation of interoperability or connected care tools is practical at the front lines of care. And the work of the task force is reflected in the final report released in November 2024 and a subsequent position paper submitted to Health Canada just recently, a few weeks ago, in support of Bill S5. Next slide, please. And so here's a brief summary of the 5 concrete recommendations from the report that outline tangible steps for decision makers to take. The first is that we need a well-defined plan and must move faster towards an improvement in an interoperability in the next 5 years. The second one is to accelerate policy and legislation to advance interoperability with critical support from provincial and territorial governments. And I'm happy to say that we've actually seen great action on this recommendation with the revival of interoperability legislation, Bill C-72, now called Bill S-5, that's, as we speak, making its way through the Senate, through Senate readings. Recommendation 3 is that you forgot about doctors. You forgot about the workflow. Provinces and territories need to address the key barriers preventing physicians and other healthcare professionals from participating in health data interoperability initiatives by ensuring that health data solution deployments impacting clinicians are co-designed with clinicians and that the administrative burden and cost of interoperability initiatives are not downloaded to clinicians. Recommendation 4 of key importance is that organized medicine must continue to be actively involved, playing an important role in providing guidance and support for physicians on interoperability through development of best practice guidelines and ongoing advocacy for education and training support. Recommendation 5 is that we must have continuous innovation through our R&D funding organizations. Keep investing in continuous innovation in digital health. Next slide, please. And so this slide refers back to a letter way, way back, a letter to the editor written by digital health experts back in 2015 in the Canadian Family Physician Journal, basically indicating that despite the many failings of current EMRs, most physicians would still not want to go back to paper. Despite challenges, there have been improvements and useful features of EMRs that have become invaluable to physicians. I'll use just one example from my practice in Brampton, Ontario. So I have integrated access to the Ontario Lab Information System, OLIS, which allows me to search for and access quite a large array of patient lab and pathology information. So for example, if someone comes into my practice and they're new to the practice and can't quite recall when they last had an FIT or FOBT test to screen for colon cancer, I can actually figure this out fairly easily with an OLIS search. It's not perfect, but it fills in, tools like this fill in more information gaps, which is safer for patients. We just need to make these tools better, more widely available, with an emphasis on clinical workflow and experience and the clinical user experience. Next slide, please. So this slide shows a highly truncated visual of the journey to integrate digital health, or what used to be called e-health concepts, into medical education in Canada. And the caveat here, this is not an exhaustive or comprehensive view. There were efforts from 2011 to 2017 to bring together clinical faculty digital health experts to create educational resources, working together with the AFMC, the CASN, and the AFPC. This actually resulted in undergraduate medical education competencies being created at that time, but not, unfortunately, not adopted. Fast forward a little bit, the Medical Council of Canada, with input from Dr. Ewan Affleck and other experts, created a new clinical informatics objective for the MCCQE exam, which then results in medical schools having to teach about these concepts. Also, the latest CanMed's 2025 competency framework revision from the Royal College of Physicians and Surgeons of Canada included input from the Data Informed Medicine Working Group that I co-chaired with Dr. Affleck. This new version of CanMeds should be released in 2026, and this framework determines how specialist physicians are trained in residency programs and has an impact on how family physicians are trained. Um, Finally, in a more tangible way, I've been leading the creation of core curriculum for digital health and AI for undergraduate medical students in my role at the TMU School of Medicine. Many thanks to our dean, Dr. Chan, as well as Dr. Hutchinson, Dr. Becker, and Dahlia Benedict, and many others for their support in moving this along. All of this is to say that progress is occurring in Canada, but it's taking place slowly. Next slide, please. So this slide, apologies, it's a little cramped, but this slide contains an interesting positive nugget about the adoption of AI technologies by physicians in clinical practice. We have recent data from the CMA's Administrative Burden Report from January 2026 on the left side of the screen that indicates 28% of physicians are using AI scribe tools in practice, compared to a much lower rate that we observed of 7% in the 2024 physician survey data. And these data points, they're not exactly equivalent, but they do give us a rough idea of what's going on. And it's no coincidence that InfoWay's AI Scribe program kicked off in June of 2025 and may have had a role in the change that we're seeing. Next slide, please. And so this brings us to the AI Scribe. Oops, thanks, Claire. This brings us to the AI Scribe investment program, which is one of our efforts to take action on the recommendations from the task force. And we had hoped to reach 10,000 primary care providers, including family docs, pediatricians, NPs, and many others. And we're well on our way. InfoWay and our partners see an opportunity to both improve the administrative burden, but also to advance better EMR data quality, standards-based interoperability, and improved analytics in primary care and beyond. Next slide, please. So the next two slides speak for themselves. The adoption and uptake of AI scribes due to our program has surpassed expectations. We went from over 6,000 registered users in the first 48 hours to more than 14,000 by the end of December, with 10,000 live users and counting. Next slide, please. So I'm going to move through the next few slides fairly quickly, just in the interest of time. You can see these results on our website, but generally, just looking at this slide here, from the initial pulse survey of participating primary care clinicians, the findings are overwhelmingly positive and also reflect findings that came out in other studies from Ontario MD and Doctors of BC. Next slide, please. I just want to, before I comment on this one, I do want to mention that while the adoption numbers look great, it's not all rosy. We have run into numerous change management related challenges. Even though AI scribes are relatively straightforward to use compared to EMRs or hospital information systems, there is still a learning curve requiring, again, critically, education and training supports and clinicians who are confident and ready to test out newer tools. Again, linking back to our medical student survey results. Here you can see the impact on clinicians. I'll leave these two slides for you to observe either afterwards through our deck or online at our Infoway Insights website. But Claire, if we can go to the next slide, there's also um, impact on clinicians and the patients is generally positive. Clinicians commenting on being more present, feeling more present with their patients, and feeling like the time spent with patients is of higher quality. There are challenges again. Scribe notes can be very long, requiring editing, meaning that cognitive load is shifting from the documenting side to the editing side, and this has been described as the dreaded note bloat. And with that, we'll move to the next slide. So, with game-changing technology in the form of generative AI, AI scribes, and related tools, we must continue efforts to make it easier for clinicians of all professional backgrounds to participate in a digitally interoperable healthcare system. Education and training is critically important in all of this. We must start upstream, providing our young physicians in training with the knowledge and skills to not just navigate a digitally enabled environment, but to lead within this new and rapidly changing environment. Next slide, please. And so finally, with the right elements of early and ongoing digital health and AI education, can we reach this near future state? I think so. As our medical student survey results show, there are gaps that need to be addressed. And I know that medical schools and residency programs will rise to the challenge. But I do think that we must be able to support and prepare our young learners to thrive in this environment and to be able to critically appraise the tools they are being asked to use. And with that, I will pass the mic over to Noel. Thank you very much.
Thank you, Dr. Wyatt, for providing this valuable insights from the front line. And also, I want to thank you for your leadership throughout this project. So our next speaker is Noelle Sandertel, a medical student at the University of Calgary. And she is also a winner of Infoway's Connected Care Clinical Student Scholarship. So Noelle also serves as the medical student representative on the Alberta Medical Association Health Informatics Committee. She leads national clinical data and health economics projects in oncology, focused on evaluating emerging cancer diagnostics and their impact on care delivery. So she is passionate about preparing students for an AI-enabled future in medicine. And she will share the student voice regarding to the digital shift and discuss the proactive learning for modern practice. No, please go ahead.
Awesome. Thanks so much, Claire, for the introduction. I'm super excited to be here. As Claire and Sanon mentioned earlier, I'll be speaking a little bit more on my experience as a med student, my experience with the Connected Care Scholarship, and on what I think are the biggest needs for students as digital health becomes more intertwined in our practice. And I'll start with talking about our experience with digital shift. So I think something that is interesting about being a medical student right now is that digital health doesn't feel like something that is coming in the future. It's kind of already baked into the way that we learn and practice medicine. And so I recently just started clerkship, and from pretty early on in clerkship, you're spending a lot of time inside the EHR. And in Alberta in particular, that's systems like Connect Care. So you're writing notes in structured templates, you're placing orders through different order sets, you're responding to different things like medication alerts, and sometimes you're even interacting with clinical decision support tools. And in some clinics, you'll even see newer tools starting to appear. So things like AI-supported documentation platforms like Scribeberry, used in family medicine clinics, for example. And these are tools that kind of automatically generate your visit notes. So in that sense, I think students are actually quite comfortable using digital systems. They're not something that is particularly foreign to us. But what is interesting, I think, is that we're mostly taught how to actually operate those systems, but not really how to understand them. So, for example, if an alert fires for sepsis risk or a medication interaction inside the EHR, we're told sort of how to respond to that alert, but no one really walks us through questions like, how is that alert actually developed? What data is it actually based on? How often is it wrong? And I think that's actually where the curiosity starts to show up among students. People aren't actually resistant to the technology. And if anything, I think most students are actually quite excited about it. But I think there's definitely a sense that these systems are shaping clinical decision making in ways that we don't actually fully understand yet. I think there's also a certain amount of healthy skepticism. So students are asking questions like, how reliable are these tools? How much should we trust them? How might they change what the role of a physician looks like in the future? And at the same time, many students are actually already experimenting with AI tools in their own learning. So you'll hear people mentioning things like ChatGPT, Claude, or other large language models that are trying to break down a difficult concept, to generate practice questions, or even to review material from a lecture. So the relationship students have with these technologies is actually quite nuanced. So we're curious and often enthusiastic about the possibilities, but we also want to understand their limitations and their implications for training, things like decision making, and also just in general, the future of the profession. So the overall feeling I describe is, we're comfortable using the tools, but we're still trying to understand the systems behind them. Next slide, please. So once you start noticing the gap between using systems and understanding them, I think a few things start to feel important for training. So the first is simply exposure to how those systems actually work behind the scenes. So in medical school, we get very good training in clinical reasoning, how to interpret symptoms, things like labs, imaging, but we rarely sort of get the same kind of structured explanation for digital systems that are sitting kind of right behind those decisions. So even a basic introduction to how clinical decision support tools are developed, validated, and even how they are implemented, I think would go quite a long way. I think another big piece here is mentorship. So some of the most helpful moments I've had in clerkship are when a supervisor actually explains their thinking around a digital tool. For example, they could say something like, this alert tends to overfire, so I pay attention to it, but I don't actually rely on it completely. And that kind of reasoning is incredibly educational because it shows you how experienced clinicians actually integrate digital information using their own judgment. I think the third piece here is to have some sort of level of data literacy. And I don't mean that we should teach every medical student how to code, but rather being able to teach students how to understand concepts like bias, validation, how data sets influence model performance. And I think those things kind of help make those digital tools seem a lot less mysterious. I think the fourth area here is actually having structured conversations about ethics and bias. So AI systems are being introduced into healthcare pretty quickly, and many students are aware that issues like algorithmic bias and data representation matter, but we don't always have space to talk about those things formally during training. And I think the fifth piece here is psychological safety, and I think that's often actually quite overlooked too. So students actually need to feel comfortable asking questions about the systems. Um, so if an AI tool or predictive model is being used in a clinic, for example, it should be normal for a student to ask things like, how is this actually validated? What population was it tested on? And if those questions feel uncomfortable to ask, then students learn pretty quickly to just accept the tool without fully understanding it. And that's probably not the culture that we want to create. Next slide, please. So because the formal curriculum is still catching up in a lot of places, I think many students actually end up exploring digital health on their own. And that can look really different depending on the person. So some students will get involved in things like health informatics research. They might join different digital health committees. Others might take short online courses or workshops that explain basic concepts in health data analytics or in machine learning. Even something as simple as learning the language around these topics can actually make a huge difference. So for example, once you understand what people mean when they talk about things like model validation or refitting, you start hearing those conversations quite differently. And you're able to follow discussions about AI tools in healthcare much more easily, and you're able to start asking different questions as well. I've also noticed that when students actually spend time learning even a little bit about how data systems work, they start sort of interacting with those digital tools differently in clinic. So instead of just accepting an alert or a risk score, they'll start wondering, where it came from and how reliable it might be. And I think that mindset shift from just using a tool to being curious about the system behind it is actually quite powerful. I think it also makes the technology feel a lot less opaque and a lot more approachable. Next slide, please. So, for me personally, I think the Connected Care Scholarship has played a really meaningful role in how I've actually been able to engage with digital health during my medical training. I think one of the biggest challenges for students who are interested in the space is simply access. So things like access to structured learning, being able to engage in interdisciplinary conversations, and honestly, access to the time and resources needed to explore those systems more deeply. So the scholarship actually helped remove some of those barriers for me. It gave me the flexibility to pursue additional training in health data and analytics. And more importantly, I think it created space to think about digital health in a more deliberate way. So medical school moves quite quickly, as we know. And I think most of our attention is naturally focused on developing clinical competency. So things like diagnosing patients, managing them, communicating with them, caring for them. And those things are absolutely central. But I think the digital systems sitting underneath clinical care are becoming just as important in shaping how care is actually delivered. So the scholarship allowed me to step back and examine those systems more closely. So understanding things like how health data is structured, how analytics can inform clinical decision making, how issues like bias or governance can also play a role in the design of certain digital tools as well. And I think what's powerful about programs like Connected Care is that they help students move from being passive users of digital tools to actually becoming informed participants in the systems that shape healthcare. And I think that perspective becomes especially important as digital health tools continue to expand across healthcare systems. I think physicians will increasingly be practicing in environments where data analytics and clinical workflows are very closely intertwined. And so having even a basic understanding of how those systems function can sort of help clinicians engage with them more thoughtfully and also contribute to how they evolve. I think programs like the Connected Care Scholarship really create opportunities for students to start developing that awareness early on in their training. And I've personally found it to be incredibly valuable, and I'm really grateful for the opportunity. And with that, that's all for me.
Hey, thank you, Noel, for sharing your perspective as a medical student, and also thank you for your great advice. Um, and we are right on time, so we now have about 8 minutes for Q&A. Please continue to send your question in through the Q&A function, and I will read them out for our panelists. Let's see if we have any questions now. Okay. So I will just take the advantage and ask my question then. Um, so I think in the survey findings Sunam presented, we see that while we have numerous digital health tools, the structured training on many of them is still lagging. And Noel, you also mentioned your point is about need for students to evolve from being the user to shaper of the system. So given that already demanding medical curriculum, I want to know what do you think is the single most critical skill that medical students should prioritize to achieve that?
Yeah, Claire, thank you so much for the question. I think as I mentioned earlier in my presentation, I think one of the most important skills you can have is sort of developing the ability to critically interpret digital tools rather than simply using them. So medical students, I think, are already very good at learning different workflows, how to navigate an EMR, how to respond to different alerts, or as I mentioned earlier, like using different clinical decision support tools as well. But I think actually being able to shape these digital systems actually requires one step further, which is actually understanding the assumptions behind those tools. So I think the key skill and what I think of is digital literacy. So being comfortable to ask questions like, where did the data come from? How was a specific model validated? What populations it might not actually perform well for and why that happens. And honestly, you don't need to be a programmer to do that. I think many students end up being scared about that in general. They're like, oh, do I need coding skills? Do I need to have a background in informatics? You absolutely don't. All you need is you need to have the mindset to try to sort of treat these digital outputs the same way that you would treat sort of any clinical information. So something to interpret and not something to sort of accept blindly. And I think if students are able to sort of develop that habit early on, so being able to be curious about how different systems work and willing to sort of question them, I think they'll naturally become sort of better collaborators with people that are actually designing those tools. And I think that's really how physicians start to move from sort of following those digital trends to actually being active shapers of those systems.
Thank you. And also, what format do you think is the best way for students to learn that? Is that like, as a core curriculum or as, like just a optional course, or as you said, you learn it during your clerkship, right? And also, I want to learn Dr. Bai's perspective on this as well, because you mentioned you have the experience in navigating this challenge, especially having led the integration of the digital health into the curriculum of the Toronto Metropolitan University.
Uh, Thanks, Claire. Why don't I'll maybe Noel can answer first, and then I can weigh in afterwards,
Yeah,
or
so I mean, I think
Sunan. Sorry.
yeah, so I think I can start. So I think that med students in general kind of feel quite intimidated by AI and digital health sort of being integrated into our practice. I mean, I think right now we don't get a lot of formal education in the topic, and what's difficult about being a med student is that we're trying to balance so many different responsibilities, right? We're trying to balance caring for patients, we're trying to balance learning clinical competency, and so those things can be quite time demanding. And so because of that, if we don't actually have formal training in it, it's hard to find time outside of our clinical practice to be able to engage in those questions and to learn those topics. I think things like the Connected Care Scholarship have really helped me because I think they've taken away some of those financial barriers for me. But it's also given me a chance to sort of learn more about health data analytics in a structured and formal environment, which I think is also quite helpful for students because sometimes you just don't know where to start, right? So I think the program that I'm doing gives me a really great starting point, and I really recommend this scholarship to a lot of people. But I think just kind of encouraging yourself and forcing yourself to step out of your comfort zone and engage in those interdisciplinary conversations are incredibly important. And I think when you're a student, you don't need to know all the answers, right? You just need to be curious. And I think most physicians would encourage students to ask as many questions as they can.
It's great response from Noel there, and Claire. I would just maybe add in, over the years. So when I was going through medical school eons ago, we didn't unfortunately have these concepts integrated, and there's been this huge gap, as you could see in that roadmap. So I've been a strong proponent of trying to integrate the instruction on digital health informatics into the curriculum so that it's baked in there. It's already a very jam-packed curriculum. But even if we can get students starting to think about the basics, to give them the tools, the vocabulary, the knowledge of where to go and how to critically appraise what they could be encountering very soon. It's a starting point, and I've been very lucky. TMU was very forward thinking in building this new school. With our dean thinking about having digital health and the future of practice as sort of one of the pillars of undergraduate medical education. And so it is embedded into the curriculum. And we've had, I've been really lucky to help construct that. And it's in a way, we've done it in a way that's incremental and that's, geared towards your which year of medical school you're in, what experience you'll have had so far in clinical learning, and how to integrate the digital health concepts in a way that they don't displace anything that you're learning, because the bucket can only hold so much, but really augments everything that you're learning, and gives you that core set of tools that you can then use to build upon, as Noel is doing with additional training, through the scholarship. And it also, I think, gives students a sense that whereas in the past, if you had an interest in health informatics, clinical informatics, medical informatics, digital health, etc., carving a pathway forward was a bit of a choose your own adventure story, and we're trying to change that a little bit. We do want to have, digitally leaders and medical leaders in the future who have enough skills and knowledge to be able to lead the way health systems are evolving over the next 10, 15, 20 years. These are critical skills. And so really, hoping to see that more medical schools will continue to embed that into their core curriculum.
Thank you, Dr. Biden. Thank you, Noel, for your really good answers. So I think from 0 to 1 is always the difficult step. And as long as we have the digital health mindset in mind, it's always a good starting point. And seems like we don't have any more questions. And I want to just wrap up the Q&A section. So that brings us to the end of today's presentation. So I want to thank you for our presenters, Sunang, Dr. Bide, and Noel for sharing your expertise and for your leadership on the initiatives that advancing digital health in Canada. And also thank you again for all the audience for your time and your insight and for your participate today. It's clear that our discussion that while digital tools like EMR and AI Scribe are becoming universal and more common in today's practice, the journey towards true digital fluency is just beginning. And I also would like to invite you to check on Canada Housing Forward's Insights website. And today's session was recorded and will be available shortly on that website. And if you want to find out the full results of 2025 Canadian Medical Student Digital Health Survey, you can also check out the link on the slides as well. And thank you again for being here. And I wish you a wonderful rest of your day.
Thank you, everyone. Bye.
Okay, thank you.